Hi everybody, this is a video about treating biofilms in the lungs. Someone recently asked the question, how do you treat biofilm in the lungs? Or something to the effect of, will all biofilm disruptors affect the lungs? And it's a really good question. When it comes to, just as a general disclaimer, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. As far as biofilms in the lungs go, in my clinical experience, the vast majority of patients don't have to worry about biofilms in their lungs. It's something that can potentially occur. In my experience, some patients with really notable mold illness / mold toxicity can sometimes have issues with biofilms in the lungs. Some folks who have a lot of issues with Mycoplasma pneumonia as a systemic microbe that's causing symptoms for them can potentially have biofilms in the lungs. It could potentially happen with chlamydia pneumonia, which has nothing to do with the sexually transmitted infection chlamydia. It's a different species of the chlamydia family, so to speak. So just basically microbes that have more of an affinity for the lung tissue, there may potentially be a biofilm component there. And so it's not something that comes up a lot, but I've certainly had patients who have these persisting respiratory issues. Maybe it's a cough, maybe it's shortness of breath, maybe it's air hunger, as folks sometimes are dealing with. Or they may not necessarily have those persisting symptoms, but it seems like we've treated biofilms everywhere else, and they have, say a history of mold illness. We've treated biofilms in their sinuses. They've used systemic biofilm disrupting agents, and yet they still seem to have a mold issue, or they're prone to relapse. And we're thinking maybe there's kind of a last stand of biofilm in the lung tissue. So when in my practice, when I think that my patients are maybe dealing with a lung biofilm, I'll typically recommend one of a couple of things. I may just try using systemic biofilm disruptors if we haven't already done that. So kind of usually be a first step in a number of cases. And it may be that enough of that biofilm disruptor that gets into the bloodstream is able to permeate the lung tissue well enough, and that'll help to disrupt the biofilm. I've talked in other videos about the different categories of biofilm disruptors, phase 1 versus phase 2 biofilm disruptors. The phase 2 biofilm disruptors are the strongest ones. They include things like EDTA and DMPS and DMSA. Silver hydrosol will be another one. NAC, to my understanding, is a phase 2 biofilm disruptor. And so bismuth, and when it's combined with alpha lipoic acid to a dithiol compound, that's a phase 2 biofilm disruptor. So a systemic biofilm disruptor may be effective, but if we really want to go after biofilms in the lungs, in my experience, it's usually the most effective to use a nebulized biofilm disruptor. So we'd actually be taking a liquid biofilm disrupting compound and then putting that in a nebulizer, which is basically a device that turns a liquid medication into a vapor form of a medication that can be inhaled, and that can be inhaled right into the lungs. Trying to use a biofilm disrupting nasal spray, which can be quite effective at treating the sinuses. To my understanding, not enough of that vapor is going to get breathed down into the lungs to have a meaningful impact, whereas with a nebulizer, we can just inhale it right down into those lungs. So the formula that I typically recommend is put together by this compounding pharmacy here in beautiful Canada, and the primary biofilm disrupting ingredient in there is EDTA. It does have some other ingredients in it as well, including iodine, grapefruit seed extract, xylitol, but it's really the EDTA, to my understanding, that's the main biofilm disruptor. So those are my thoughts about biofilm disruption in the lungs. So thank you for the question, and if anybody has any other questions on this topic or anything else, just post in the comment section below, and I'll answer as soon as I can.